Thank you so much for the invite. I think Shruti did this on purpose, probably with my personal tryst with non-surgical methods. Otherwise, I have no financial disclosures. So let's keep this quite simple. We have already heard a detailed lecture on oculofacial aging. So there are many factors that we have to deal with, like genetic factors. Some people age very quickly. There are racial factors. Then environmental factors like obviously the ultraviolet radiation which causes photoaging and its changes on the skin, and lifestyle exposures such as smoking and improper sleep and hydration and all those. So what happens when we start aging in and around the face and especially the eye? We have seen how dermatochalasis, blepharotosis, and eyelid malpositions are being taken care of, also prominent eyelid fat bags. So this is how generally a patient comes to us with the request, please make me look young. So once this happens, we need to get into that zone where we are actually assessing what the patient wants per se. And while examining the patient, as much as you listen to them, you have to keep evaluating the skin tone, the quality of the texture and the texture of the skin, the eyelid-eyebrow complex as a whole, whether you need a surgical approach or whether you need a non-surgical approach. Relevant medical history, dry eye diseases, the use of antiplatelets because it can cause bruising, systemic conditions such as thyroid-associated orbitopathy, previous facial traumas or procedures, especially previous procedures like fillers are usually hidden to you, and psychiatric history because there might be patients who have a body dysmorphic syndrome and no matter what you do for them, they're still dissatisfied. So let's look briefly at the non-surgical approaches that are available. We'll begin with the most commonly known one, which is the botulinum toxin. So you know it is derived from the Clostridium botulinum and it was first approved for its use in strabismus. And the onset of action generally is from 3 to 5 days and you have maximum effect from 3 to 4 weeks and it lasts for 5 to 6 months. It's available in different preparations. Most commonly used one is the botulinum toxin A. And depending upon the formulations that are available, the concentrations will also vary accordingly. So here is a quick and brief video on how you prepare botulinum toxin. So for which you need normal saline and on what concentration you need to inject. In aesthetics, we stick to 2.2 to 2 units per 0.1 ml. Here, you draw that much amount of normal saline and you inject it into the bottle. And a few things that you need to be careful about is Botox. You should not vigorously shake the bottle because it can affect the efficacy and it needs to be used as soon as quickly possible. Let's say in about 4 weeks if stored properly. So the contraindications, just to touch upon this, myasthenia, of course, you can be causing fatal complication to the patient if they're on any antibiotics like the amino acid antibiotics or any other inflammatory or infective conditions that they may have at that point in time, and obviously for pregnant and lactating mothers. So you can also achieve a chemical brow lift in patients who are reluctant to undergo blepharoplasty, and this is achieved by paralyzing the depressors of the eyebrows, and also to iron out the forehead wrinkles such as this, the use of Botox is quite useful. Similarly, patients who have very strong furrow lines, if you want to smoothen out a bit but without compromising on the natural look, you can also use Botox injections. Now let's shift and we are going towards facial fillers. So fillers come in different preparations, such as the hyaluronic acid fillers. Then you have the synthetic fillers, the autologous fat, and collagen. So the thing about fillers is it's a collagen replacement product, and it's chemically similar but has different structural forms, based on which you have as thin ones, ranging to as thick ones, and based on the site that you're going to inject, you can use them accordingly. So the benefit about hyaluronic fillers is, in case you overfill the patient, you can always use the drug, which is hyaluronidase, to get rid of its effect. So I do not have many patients who are very keen on fillers in my OPD. This was one patient who was keen on getting rid of her theatre of deformity. This is an immediate post-injection picture. Later pictures weren't available, where you can see that there's a slight reduction in the prominence, but yes, she does have periocular hyperpigmentation. The other fillers are the synthetic ones. These are more long lasting, but associated complications could be necrosis, infection, and so on. Autologous fat has been dealt with beautifully by Shruti, so I wouldn't be touching upon that. The benefits that are that it gives a natural result and it has a long-lasting solution as well. And since it's derived from the person himself or herself, it's safe and with lesser adverse effects. Then, of course, you have the collagen ones. Now, I'm sure most of you are quite intrigued as to what this particular heading is doing here. These are cosmeceuticals. Basically, these are ingredients that are active, that have an effect on the skin, but have not been included under a drug criteria. And they form a huge part of all the cosmetics that we use in our daily life, such as the sunscreens that you use, which give a physical barrier towards sunlight, and you have retinoids, which range from the retinoic acid to the retinols, which take care of the gentle wrinkling that begin to form after the age of 30, and neuromuscular relaxants such as arginine, Vialox, and so on, which are included in most of your anti-aging or wrinkling creams. A few others are those which are skin lightening, such as your kojic acid, hydroquinone, azelaic acid. If you have noted, you would see this specific pigmentation, redding creams and all that. These all contain this. And you also have peels such as the AHA, BHA peels and varying concentration of peels. So like I said, I do not have direct patients who are on cosmeceuticals. So a dear friend shared this picture of a patient who was on the use of a product called as Vasugi. And what was noted was it gets rid of the static and dynamic rhytids and also increases the timing between two Botox injections. Similarly, the dynamic rhytids, you can see that there's a gentle ironing out of the wrinkling, especially the crow's feet. And similarly, for this forehead wrinkling, it's becoming less prominent, and also it prevents forehead pigmentation, according to her. So the other things that are available in the market are the use of lasers. You have varying lasers, you have ablative lasers, which removes the top epidermal layer, and you have those that work at a subdermal layer, which increases the collagen levels in your skin and adds to its firming. And also latest ones are the HIFU or the ultrasonic energy that is used, where there is no destruction of any of the skin layers. And the use of PRP, which is platelet-rich products, are also gaining popularity. So I'd like to end on this note. We are fighting aging, which is a physiological process. So it's important that you need to follow a very balanced diet, have a healthy routine, and have a basic skincare routine so that the treating doctor would be able to help you in a better way than just relying on the drugs and the cosmeceuticals that are available. Thank you.
Thank you very much, Anju, for that fantabulous talk.